setting up a stretcher, and they seem to be rushing around quite a bit. All right, it looks like they may have some injured people.
My name is Mark Petroselli. I'm a 24-year veteran of the Jersey City Fire Department. On November 5th, I was assigned to roof ventilations on a 4-story wood frame building which is located on Bramhall Avenue, Jersey City.
That's 625 Bramhall Avenue here in Jersey City. The fire obviously raging out of control.
It was so smoky, zero visibility. And what was happening, I tripped over the debris. So when I fell like 15 feet, and when I hit the ground, I was stunned for a while. As I was getting up, removed my Scott mask, I felt like I was having a heart attack, and that was from the collapsed lung. And then after that, it was just total darkness.
It's up to a 2 alarm right now. As far as any injuries are concerned, we have at least one that looked like that was to a firefighter. That does unfortunately look like a firefighter to me. Of course, we will continue to keep you up to date live in Chopper 4. I'm Kai Simonson, Tom and Erica, back on over to you.
Dr. Annoy Otley, trauma surgeon at Jersey City Medical Center. I've been involved with the medical center since 2002. Being a trauma surgeon can be very challenging. It's one of the positions in the hospital where really your duties from day to day are not really scripted.
My sister-in-law, who was working at the time here, was basically a main person here helping my family out.
I am Peggy Petroselli. I'm fortunate enough to be Mark Petroselli's sister-in-law. I'm a nurse at Jersey City Medical Center.
It was November 5th, 2012. So we got a call that we had a person that had fallen 2 stories.
This particular day, somebody in the hospital said, "Did you see the fire out 7 West's window?"
I'm not sure if at the time they actually told us he was a firefighter, but we discovered that once they brought him in because he was in uniform. He was covered in a lot of soot. One of the first things that we'll do once we get patients in is to do a full head-to-toe assessment.
Dr. Otley was in front of the stretcher, and he said, "Peg, he's going to be okay. We're going to be okay. Let's get in. We got to get the chest tube in. His lung is completely collapsed."
He had multiple fractures, so ribs, his sternum, a fracture to his ankle, collarbone, a collapsed lung that required immediate treatment.
We have the right people in the room. We're going to be okay. And I just kept saying that. If the right people in the room, which I'm very confident with our trauma team, the right people were in the room, thank God, that day.
And I just see that they don't care who you are here, they're going to give you top-notch treatment.
Multiple bony fractures, even after being repaired, do require extensive rehab to regain full function.
I was in the hospital, I went to a lot of therapy. I did therapy for like 3 days a week. Seen all the doctors on a regular basis, and I'll tell you what, they really made me feel very positive about this whole thing that went down. The care that I got through the hospital was just outstanding.
Again, when you're talking about Jersey City Medical Center, you're glad that it's recognized as the trauma center for the area. Very proud of them, from the doctors to the nurses to the physical therapy. I mean, as I say, every department gets involved in a trauma, and we cannot do it one person at a time. It is a team effort, and it works out to be a very good team when you come into Jersey City Medical Center.
I came in not looking too good. I was pretty busted up. And I left here with a lot of dignity. I feel good, and I'm back to work a very short time.
We do like success stories.
Thank you.
We do like success stories.
Thank you, and to the staff, the hospital, everybody's unbelievable.
To me as a trauma surgeon, enhancing life means being able to take that severely injured patient back to a state in life as close to as they were before being injured.
At Jersey City Medical Center and Barnabas Health, we're a not-for-profit organization who takes all the proceeds at the end of the year and reinvests them in our community with our mission of enhancing life. For-profit organizations have shareholders, so they have to remember that they have to pay their shareholders also. And I think that's a major difference. All of the proceeds from our facilities go to really enhancing services throughout our community.
My name is Demetria Benjamin. I'm a patient at the Center of Comprehensive Care. I got to the center when I found out about I was HIV positive. When I got diagnosed with it, I became numb. I remember praying and asking my higher power to put me in the best hands. And He put me in Dr. Eileen Scarsini's hands, and I'm so grateful and thankful to her.
I'm Eileen Scarinci. I'm a doctor of nursing practice at the Center for Comprehensive Care. There's a special bond because I know how difficult it was for Demetria. She had so many things against her.
She's more than just a doctor to me. We grew a bond where I knew I can trust her with anything.
You know, we just connected, and we just never quit.
And that's when I knew that I had a bond with her, and that's how I got clean.
I said, today is the first day of the rest of your life. Let's go from here.
She said, and if you want to live, we're going to live. We are going to live, Demetria.
Demetria, you just have to keep going and going and going and never give up. Just take your medications and, you know, it's going to happen.
She called me on my phone and she said, Miss Benjamin, it's been 7 weeks and you're undetected. I said, what? 7 weeks? She said, yes. She said, I don't understand it either. She said, but you're undetected. And I was like, wow.
At the Center for Comprehensive Care, it's like a large family, and we all support each other.
So I always stop in and say hello. We hug, we give each other a kiss, and I let her know how I'm doing. She lets me know how she's doing. You need someone in your corner to be your strength when you're weak, to be your best friend. And not to look down at you, but to look at you like you are somebody and not just a nobody. You can live your life any way you want to. I consider myself as being an activist. I go to NA groups, I go to HIV support group, I go to Bible study, I go to church. You can do whatever you put your mind, your heart, and your spirit to do. Basically, I speak out to the newcomers and even the old comers, and I let them know that I tell them my testimony. I never thought from where I was at that I would make it to where I'm at today.
When I think about trying to get the entire organization aligned and moving in the same direction, those two words, enhancing life, really make such a big difference in how we treat patients, in our whole overall goal. We're an integral part of what happens in Jersey City. We're the tertiary provider, the only trauma, the only regional open heart surgery center. We're the regional perinatal intensive care center. We have a comprehensive behavioral health program. We provide the medical infrastructure for Jersey City. We try to focus on where are the gaps in healthcare in Hudson County and Jersey City. We take our proceeds and we look for ways that we can enhance the life of patients in Hudson County.